Well, the FDA has announced it's putting strict new restrictions on use of the Johnson & Johnson vaccine due to the risk of rare but potentially life-threatening blood clots.
Johnson & Johnson is only recommended for people who can't get another vaccine or won't be vaccinated otherwise. Well, here with more information on those restrictions is our good buddy, Dr. Timothy Quinn of Quinn Healthcare in Ridgeland. Dr. Quinn, thank you for joining us today.
Thank you for having me.
So what's behind this latest CDC information?
Well, I want to read a statement by the CDC and FDA leadership. And it states, today's action demonstrates the robustness of our safety surveillance systems and our commitment to ensuring that science and data guide our actions. I mean, this revision of this emergency use authorization that was issued before, it is basically a demonstration of their commitment to safety. I mean, it's so funny. I just saw my little dog walk behind me, and sometimes my wife and I will get angry with the dog because in the middle of the night, the dog is just barking, 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 and we jump up out of the bed and we go look in the backyard, and there's just a cat out there, and it was safe. But we don't get angry with the dog because we understand that the dog, like the FDA or the CDC, these organizations, they're trying to keep us safe, and they're letting us know that we need to be on the lookout. We need to be aware, and we're following the science and data. And if we look at it like that, and basically I made this explanation for a patient earlier today that was just so frustrated. I just hate these organizations. I led her to understand that this is for our safety, and they're looking out for us. Even after they've already approved it, they still monitor because safety is the #1 priority.
Dr. Quinn, did we not do enough testing on it? Do you think that was an issue?
Not at all, not at all. Because whenever a new therapeutic regimen is brought into the market, they test thousands, hundreds of thousands, you know, but here's the deal. After a medication or a treatment has been introduced to the market, the testing does not stop. The surveillance does not stop. The safety priority does not stop, and that's what's going on right here. The FDA, they gave the emergency use authorization because we needed something, and the science has demonstrated it worked. As soon as people started getting vaccinated, the death rates went down, the hospitalizations went down, but they still continue to monitor, and what they determined at this point is the messenger RNA vaccines, such as the Pfizer and the Moderna, are safer than the Johnson & Johnson. So what they're telling us is still get vaccinated, but if you have a choice, choose a safer option. So they're just giving us the best case scenario, and this is really a demonstration of their commitment to safety, and this is actually a good thing that's reassuring.
Dr. Quinn, should people who have gotten the Johnson & Johnson shots in the past, should they be worried about anything?
I'm so glad you brought that up. The data is overwhelmingly demonstrating that the individuals that were affected the most were younger ladies, less than 50 years of age. And some of the science is crediting that maybe they have a higher estrogen level, which is associated with a higher probability of forming these blood clots. But the good news is the majority of the events overwhelmingly were within the first 1 or 2 weeks. So if 2 weeks have gone by since somebody has gotten their vaccination, they're relatively safe as far as from this particular risk. So I was able to reassure a patient earlier today of that, and she was very, very happy to hear that information.
Well, that's good news. Yeah. Absolutely. All right. Dr. Timothy Quinn, Quinn Healthcare, thank you so much, as always, for being with us.
Hey, thank you for having me.